It's a shopping must. Visit today.
I think over the course of this last year, most of us have become a bit more self-aware, especially probably when it comes to our mental health. That can be a good thing, but if you are struggling, as we talked this morning, no doubt you're looking out for some help. So the perfect time for us to bring Dr. Chelsea Ryan into the conversation. She is with CHI Memorial Integrative Medicine Associates. Great to see you.
Good morning. Nice to see you as well.
You know, I guess one of the difficulties is, one, if you're struggling right now with a little bit of depression or a mental health concern, maybe part of the issue is you feel alone. And maybe part of the issue is that you are struggling, but you're not always aware of it. Is that true?
That's very true. So I think what I've talked about with a lot of my patients is that some mental problems that they've had, like anxiety or depression, but there's many others, that they have been able to deal with those on their own without the help of medicine or therapy. But during the pandemic, where we've kind of been isolated, some of those issues have been put kind of what I say is a pressure cooker, for lack of better terms. And there's been some real struggle with a lot of anxiety and depression throughout the pandemic, especially when you're isolated from people that you were normally able to go and socialize with.
So you talk a little bit about being self-aware. That's very important. And then self-care. Are there things that you encourage people, Dr. Ryan, to do at home? Does that kind of empower you sometimes more than seeking outside help?
So I think self-care is part of mental health. It is not a treatment for mental illness. So I kind of think of it as something like when you are trying to prevent high blood pressure or diabetes. Self-care are some of those preventative and maintenance steps that you can take to help keep your mental health good. So things like exercising daily is really helpful, eating healthy and drinking lots of water, thinking positively about things to kind of challenge your negative thoughts, things like that, and also not isolating. I think, we've come up with some really creative ways during the pandemic to not isolate using Zoom, or I know that some of my patients who know some other vaccinated people can, according to the CDC guidelines, can, socialize together in a safe manner. So a lot of those self-care things are things to hopefully help prevent some problems or worsening of mental illness. It is not a treatment, but just kind of like a maintenance plan.
You know, I'm gonna pick out something you said real quickly, and it's not meant to pick at you at all, but I bet other people might have heard it and they're questioning a little bit. So you were very careful, understandably, to say if you're vaccinated, then maybe you can hang out with other friends who are vaccinated. Is that part of the difficulty right now, though, Dr. Ryan, that people are missing their connections and that this line of vaccine versus not is interfering for many people?
Somewhat, yes. And I think that it is important to follow those CDC guidelines, and it is important to talk to your primary care doctor about being vaccinated and the safety of, socializing with people, that masks versus not masks. So yes, I do think that this pandemic has been very difficult, keeping those connections, not seeing family and things like that. But not seeing family in the sense because we want people to stay healthy. And, I haven't seen my grandparents in over a year, and they live up in Western New York, and they've been recently vaccinated, and they're going to come meet their grandbaby for the first time. So that's been really hard, but I know that the safety and the health of my family is more important than the need for me to see them at that moment. I want my grandparents to live a very long and healthy life, and we just weren't willing to take that risk.
Right. So how important is conversation? And I know one of the things that you and I have talked about before is that in your training as a doctor of osteopath, that's part of what you learned even more so in medical school, was that old-fashioned way of listening to people.
Yeah, I think that's a very important way, and we've talked about this before, is that your patients will tell you the problem. You just have to kind of listen and put those pieces together. And so I really urge people who even they may not think they're going through any mental health problems, but have some questions about it. I think it's important just to reach out to your primary care provider to talk about those things. They may offer you some suggestions or things to even look out for, therapy or medications or a combination of both. I think it's important just to have that conversation with your primary care doctor so they can offer you some types of guidance and maybe some interventions that may be helpful.
We've kind of glossed over a little bit in a generalized way, but no doubt there are people watching this morning who are really struggling. A minute left. You wanted to make sure that we did provide the suicide prevention hotline number for people because sadly it can get into a real dark place rather quickly for people and they need to have an outreach.
That's exactly correct. And so if you personally or a friend that you know is struggling with thoughts of suicide, harming themselves, or even that you have concerns for a friend, this hotline is used for you personally to call 24/7, or if you have concerns about a friend, never, never, never feel like you can't reach out. And so I wanted to provide this number in case anyone was having those types of thoughts.
And if you do want the face-to-face here in Chattanooga, we also have a walk-in crisis center called the Johnson Crisis Center.
Yes, that's exactly it. It's a walk-in crisis clinic, and so if that is open, you are able to go there, no questions asked. Also, you are always able to go to an emergency department or call 911 if you are in crisis.
Well, it is wonderful talking to you. I hope your grandparents thoroughly enjoy their new grandchild, and thank you for the time this morning.
Thank you for having me.
You can find Dr. Ryan again at Memorial's Integrative Medicine Associates at Taft Highway on Signal. Their phone number 866-2004.
Think Senior